Great seeing you again, Dr. Verbsky. How you been?
Good, how are you?
Doing very well. Been staying busy with all this pit stop stuff, but you've been staying busy too.
Yeah, we've had some more people coming through, and it's been nice to get the word out. I really have enjoyed looking at the other pit stops too.
Oh, thank you.
Yeah, I've learned about places I didn't know existed, and they sound really interesting.
You know what sounds really interesting is what you do, and we really discovered that the day we came and checked out your business, and you've been doing this for a really long time. And I think for the people that aren't too familiar with you yet, the first question that I'm sure that at least was on my mind, it's on their mind, is how does one decide to go into that sort of line of work?
That's an excellent question. My journey to audiology was kind of a twisty-turny way of getting there. So I've always loved music and I've always loved science, both. And when I was in college, I majored in music and I minored in psychology, and I went and taught music in the public schools for 7 years. I was a band director, choir director, general music teacher, private teacher, all that. And I just found that for me and my likes, I preferred teaching one-on-one and small groups rather than the large groups. I did the large groups really well, and people didn't understand why I didn't want to keep doing it, but it was just something that I enjoyed working more one-on-one, like we're talking now. And so a friend of mine invited me to come to her hospital and job shadow all the different specialties. So I job shadowed in PT and speech and audiology and OT and in the lab and just all over the hospital. So when I job shadowed the audiologist, I loved doing diagnostic testing, and that was a lot of what she did at the time. And so I did some more job shadowing other places, and eventually went and got my master's in audiology. Had to do some repair work, they called it, to my original degree. And it was just a great fit for me. So I still do music on the side, still a musician, still play, but you know, day to day, I love helping people hear better and what they're missing, and I love problem solving, I guess. That's my biggest thing. I love problem solving.
There were two things that really stood out to me when you said you loved running the diagnostics, and that's where I was like, okay, she loves being a problem solver. I hear that. And the other thing I heard, and it really caught my attention, I love music as well. And it sounds like that was almost kind of the gateway in some sense, because obviously you're creating art, you're creating art when you're creating music, and I mean, it is a hearing medium. And is it fair to say that's kind of what opened up the door? And why do you think that was?
Well, oddly enough, my dad worked for the phone company forever, and I grew up taking phones apart, putting phones together. I'm a little geeky that way. So I love electronics and circuitry and sound, and you know, I ran a soundboard at church and things like that. So, you know, I just kind of pulled all that together, the science-y stuff and the music stuff, the sound part, all just kind of came together in audiology for me.
That's so cool. And talk about the best form of technology that we have on our head, right?
Exactly.
And do you find a lot of similarities there to say, like, you know, when you're running a soundboard and you understand the way that the piano needs to sound, the vocals need to sound, are we processing all these different sounds in different ways and different frequencies similar to what you were learning when you were doing things on an audio board?
Oh, absolutely. Our auditory system is miraculous. I mean, it just really is miraculous. The fine tuning that we have makes our soundboards seem really big and clunky.
Yeah.
You know? I mean, our inner ears detect, you know, just within, you know, hertz, 1 or 2 hertz, and you can tell the difference, you know. And, you know, we do soundboards in bandwidths that are half octaves at least, you know, third octaves. And we can detect and fine tune way smaller than that. And it's incredible. I mean, the ear, the auditory brainstem responses, the cortex in your brain for auditory reception called the temporal cortex or auditory cortex. It's all tonotopically tuned. So it's like a piano keyboard. It stays in order. And even in the nerve bundle, around the outside of that nerve bundle are the high frequencies, and down inside are the lower frequencies. And it's not just a mishmash. It's all very organized. And when we lose part of that, it takes a lot of loss to really show up on an audiogram, but not a lot of loss for someone to understand that they're not hearing what they used to. Does that make sense?
It does. And the other thing that really just stood out to me as well is like how much our hearing plays a role in all of our other senses, right? And you said something to me the first time we met, and I believe you referenced Helen Keller.
Yes.
And it's one thing to not have your sight, and you think, when you can't see a beautiful sunset, or when you see something that's just absolutely beautiful, it will give you the feel. But there's something about, and I guess I'm going to go back to hearing a beautiful song or something that gives you the feels, and how much extra work is being done in the brain hearing something and giving you that sense of emotion and everything else. It really sounds like it is a perfect orchestra that is playing in your head because of your ears. And what is it like to help someone who perhaps lost their sense of hearing, or it's not what it used to be, and because of the years of experience and really trying to be a problem solver, you're able to help bridge that gap once again, to help them hear the sounds that give them the feels, hear the songs that used to make them want to dance, and be able to hear a loved one's voice more clearly. What's that like for you?
It's really fun. I love it when people are willing to work toward their goals and really lay it out on the table and say, I really want to be able to hear, well, I'll just reference someone that came in yesterday. He's got goals of, I want to be able to hear between 6 and 8 feet away. I mean, he's very particular, but I love it because he has a certain situation in mind. He wants to be able to understand the speech from a bit of a distance, not just like you and I here, but maybe when we were talking across the room, he'd like to be able to understand what you were saying. And with his older hearing aids, he couldn't do that. But we've come up with solutions for that. And he is just thrilled. So the more technology advances, the more we can meet the hard goals, the very particular goals. And that is great when we have the technology that can do that. Some people, it's not a hearing loss that's in their ears, but it's a hearing loss that they've sustained in their brain. So then we've got central auditory processing. Their ears, their audiogram, stellar, perfect hearing. And yet, they go into a restaurant, they cannot carry on a conversation. You and I could carry on the conversation just fine. And my hearing's not quite as good as theirs on the audiogram. But they struggle. And to the point where they cannot go to a busy restaurant. So, what do we do with that? There's a couple of different things. Once we diagnose which auditory deficit they've got, and if it's just the hearing and noise, there's technology now where we can actually put a remote microphone on the table, and everybody's voices within a certain distance are picked up, and it goes around and it finds the dominant voice, and it streams it with a Bluetooth streaming directly to their hearing aids.
Wow. So I got to ask you this, because I'm thinking back to when we came and visited your office. It seems like you're using top of the line stuff, and again, I'm not an expert in that field, but as I'm looking around, I'm like, okay, I can definitely see how this gets the job done. But I'm curious, knowing that you are inherently a problem solver, do you have your own techniques that you throw into the mix that you've seen what other industry professionals are doing and you're like, okay, yeah, this works, it gets me up to a certain point, but have you had to put your own little spin on things to take things to the next level?
Absolutely. Experience is the best teacher, and I've had over 30 years of experience. So, yeah, I come up with tips and tricks, and I call them tools for people's bags, and they pull out the different tools that they need. And it's not all technology. Some of it's actually therapy. So if there's auditory processing problems for, say, a child that is in school, and we figure out which problem they've got, it might be decoding. So maybe they grew up having a bunch of ear infections, for instance. They have on the audiogram normal hearing, but yet they're just not able to understand and hear the language very well at all. And that can lead to behavior problems, low self-esteem, poor grades, all of that. And all we do is we do a round of 14 weeks of therapy targeted on which deficits they have, whether it's decoding. Say you learn to hear the SH sound, shh, like it's underwater. If you've got fluid in your ears for a time and you're in that stage of I'm learning my speech sounds, your brain is going to remember what it sounded like through the fluid. And then once the fluid is gone, it doesn't hear that sound anymore for shh. And it hears, regular shh through the air, and it doesn't know what it is because it missed the learning window. So we have to reteach the brain, this is what shh sounds like. It sounds like the brain would just adapt on its own, and for many people it does, but not all. And it depends on the length of time of the auditory deprivation. And it's so common. I've just been kind of blown away by the number of kids when parents read my website and they read my story about my daughter and finding out, oh my goodness, she has auditory processing disorder. That's part of what's going on here. She had some temporal problems where her speech just sounded way too fast for her brain to process. And her processing speed was slower, and we worked on that, and she went from D's and F's in school to A's and B's.
That's awesome.
Yeah.
I got to ask you this because I found what you were doing incredibly fascinating when you were going through the process of actually teaching a student virtually. And when we were there watching you do that, and I would have to imagine that you have to have a patience like no other, because the thing is, I'm sure it gets frustrating for the students sometimes, and you're there to encourage them that you can do this. How do you maintain that patience and that composure to make sure that they're feeling encouraged the entire time? Because if it's the first time they're hearing those sounds for the first time, I can only imagine the difficulty in that. I mean, we take everything we do for granted sometimes, and like you said, you would think they'd be able to just snap into what that new sound would sound like. But
No.
how do you stay patient through it all and give them the encouragement that they actually need to where they are successful and they are getting the A's and B's and taking their life to a whole new level by just exploring this new sense that they have now?
I'm a teacher at heart. I started being a teacher when I was 5 years old, and my backdoor neighbor Mikey couldn't talk right. His speech sounds, he had articulation problems, and instead of saying drink, he'd say he wanted a mink, and my mom didn't know what he wanted. So we would sit in the sandbox and I would help him with his speech. And I've just...
This was at 5 years old?
This is at 5 years old.
Okay, so I thought that music was the gateway, but it sounds like it started at 5 years old.
I've been a teacher at heart I mean, my whole life. My whole life, it's just who I am. And I love teaching. And I think that that's what makes me a lot different than some of my colleagues in the field of audiology. They're under time constraints. And that's why I went into private practice, is because I didn't want those time constraints. I wanted to be able to teach people what they needed to know. And not only doing the therapy teaching, but informational teaching. And so I do that with tinnitus patients. A lot of what they need is information, and then they need somebody to be a coach or a teacher and kind of apply it to their life, their new understanding. And they can work out ways to help themselves with all the tools I put in their tool belt, and they arrive at habituation then, which is not noticing the sound. Kind of like if you go to somebody else's house and you hear their refrigerator kick on and kick off, you don't hear your own refrigerator do that because you have habituated to the sound of your refrigerator.
You're so used to the... Okay, so you don't even hear it. That's, well, kind of like here, we're downtown right now. You probably can hear the buses that are driving by. You can hear the, the ruckus, whatever's happening, the alley behind. I've learned to tune it out completely because I'm just so accustomed to it. So that's a really good way to...
That's habituation.
Habituation.
And when people have tinnitus, ringing in their ears, any other kinds of sound, whooshing, hissing, roaring, those sounds in their head, and it's in their head, it's not like they're crazy, but the brain is actually making those sounds.
See, I hear that all the time. Growing up playing music, standing right next to the drum kit and the cymbals. My really good friend Mike, he says, "Oh, I have that ringing all the time, daily." So it's kind of, it's more in your head? Is that what you're saying?
It is in your head. I can't hear your tinnitus and you can't hear mine. It's called subjective tinnitus. But there is, interestingly, and I've heard it once in my career, objective tinnitus, where the ear actually is making the sound so loud that other people can hear it. It sounds like a hearing aid feeding back, having acoustic feedback.
Really?
Whistling.
Huh.
Yes, when I was in my training, the audiologist knew this guy, and she, set me up. I'm like, your hearing aid is whistling. Give me your hearing aid. And he turns, and there's no hearing aid. And I'm like, and they just both started laughing at me. I was like, what? And it was objective tinnitus. I'd read about it in textbooks, but I had never, experienced it myself. And I've never run across anybody else who's had it yet, but truly. But most tinnitus is subjective. So it's not a real out in the world sound. So I actually have these wristbands that buzz. They have different buzzing tactile feeling to them, and you wear it like a wristwatch. It's by Neosensory, and the person then, when someone like you and I are talking, or there's birds, or there's traffic, it will pick up sounds and it will buzz the different frequencies in different locations along the wristband. The brain learns that the tinnitus it's hearing is not creating a buzz, and it starts ignoring it because it's not a real sound. So for people who can't just learn to habituate through the exercises that we have and the other tools, this has been a godsend. It's a great new tool that we've been able to use with people to do that.
That's really cool. I want to ask you about this real quick. You said your daughter was technically one of your patients as well, right?
She actually, I was learning about auditory processing disorders in school, obviously, but at that time, we really didn't learn anything about treatment. So once we had her tested over at Ohio State, where I'd done my PhD, and we got the diagnosis, then I was looking for ways to come up with some treatments. And I ran across a group called IGAPS, and they're the International Guild of Auditory Processing Specialists. There's not just audiologists, there's speech language pathologists, there's psychologists, there's neurologists, all of those different specialties in the group. And they all of us work with auditory processing disorders. And I went to their conference in Kansas City, and I was sharing my story with the group. And one of the biggest names in auditory processing disorders today is Angela Alexander. She's done a TED Talk, and she's worldwide famous. She's also done a new movie now, a short documentary, and it was at a film festival and like won first place. It's called Between Two Ears, I believe. And she had a program that was telehealth. She was in Australia at the time, or no, she was in New Zealand at the time. Then she moved to Australia, now she's back in New Zealand. But she worked with my daughter. So she worked virtually with her, halfway across the world. And she ran her through the Buffalo model therapy because I had not learned it yet.
So you literally were able to refine your process by helping your daughter in that capacity. And it reminds me a lot of this story. Do you love reading Napoleon Hill books?
I haven't.
Okay.
No.
So there's a really great story in the book Think and Grow Rich, where he talks about his son, who was born without a certain piece of something in his ear, so he was deaf. But what I loved about that story was talking about persistence and his son, was bound and determined to hear one day. And long story short, later in his life, he started. He became a salesman for a piece of equipment that would allow people to hear later on in life.
Okay.
And became really wealthy and dedicated his whole life to helping others hear. Do you get that sense of impact every single day that you're creating this ripple effect in people's lives and their families through the work that you're doing every single day? And I immediately thought of that story when you mentioned your daughter. And being able to help her and point her in the right direction, then watching you do the virtual lessons with your students. What's that like for you every day, being able to do that?
It's wonderful. I mean, that's what life is about making a difference in other people's lives, serving other people and lifting them up. And I have a job where I get to do that every single day. And so it makes wanting to work, I can't think of anything else I'd rather do. So it's so amazing when you see the change in people's lives. I mean, going from D's and F's to A's and B's, in the span of a few months. Wow. I mean, every day there's a wow. I mean, who doesn't want to live a life with every day having a wow?
I like a good wow every now and again.
Yeah. It's like, every day people come in and it's wow, because they've waited so long to get help for the most part. And I wish that people, if I could say one thing, it would be don't wait. If you know or you suspect that you've got a problem and you want a solution, take that step. Don't wait. The wows are just as good if it's a mild problem as if it's a severe problem and you've waited 10 and 20 years, So.
Well, there's someone out there right now who's either watching this episode, listening to this episode, and there's someone that are probably thinking to themselves right now, wow, I'm glad that I'm consuming this content at this moment because Dr. Verbsky has exactly what I need. What's the best way for them to get in touch with you and get that process started and help prepare them for the journey that's ahead?
Just pick up the phone and call. That's probably the easiest thing, because a lot of times I'm able to come to the phone and we can have a 15-minute conversation right then and there about what's going on, and not just call and get a receptionist and sign up for an appointment and not know where we're going with this, because each person is unique and not everything starts at the same place. I just talked with a man yesterday. He called me about 4:45 and we talked for probably a good 20 minutes. He had tried going to an audiologist, and he's really, really bothered with his hearing loss, but his hearing loss is a difficult to fit with hearing aids hearing loss. And he has some other problems as well. He has sensitivity to loud sounds, and the hearing aids were just too loud, too loud, too loud, and he couldn't get the benefit from them being fit the way they were fit. And it just takes a lot of experience to know. You've got to have seen thousands of people like I have to know what to do. So he's going to come in. We're going to try working with all of his issues and not just what looks like on the audiogram. So for him, calling was the best. So I'm sure that we can put the phone number down, but it's 513-342-0064. And if you get the message machine, leave a message, because I personally call people back.
I'm a talk to you on the phone kind of guy. If somebody shoots me a text or an email, I'm not going to get back to it right away. But if you want something right here and now, like, yes, give me a call and I will call you back. And I feel like we've lost that, especially in today's day and age where people are just so into their, phones and emails and online and everything. And don't get me wrong, I've fallen victim to it many of times. But I think that conversation is the most...
It's enlightening.
It's enlightening, and I feel like that's something that's lost, but how important it is. And of course, you being in the position that you are giving people that ability day after day to have those in-depth conversations. I've really enjoyed this conversation today, and there's someone out there right now, again, who's listening to this or watching this right now, and I always love asking my guests if there's one thing that you can help them take with them for the rest of the day, the rest of the week, the rest of the month, the rest of their lives, a lesson that you've learned over just the course of you being a human being and of course through your professional work as well, what would that be?
Be your best self for those around you. So invest in yourself. Put yourself in a place where you're filled up, you're powered up, you are not struggling to relate or communicate, and then you can go about the business of being a part of everyone's lives around you in the best way possible.
That's awesome. I'm certainly going to take that with me for the rest of the day, the rest of my life, and as always, great seeing you again.
Good to see you too. Thanks.